Well, first of all, liver disease is very common, but it's also something that most people are not aware of. So only in the later stages might they develop jaundice or swelling of the abdomen. Liver disease effectively means inflammation of the liver. Normally there is very little inflammatory activity in the liver. In liver disease, from a wide variety of causes, inflammation can lead to scarring, and that scarring, called fibrosis, can turn into cirrhosis. And it's recognised that liver disease, the commonest causes being alcohol and fatty liver disease, represent a major health challenge for the 21st century. There are lots of causes of liver disease, but the two commonest, alcohol and fatty liver. First, alcohol damages the liver, the inflammatory change leads to scarring, and that scarring at an early stage may be reversible, hence if we can catch our customers early that would be much better. In a later stage that scarring is irreversible and develops into cirrhosis. The same with fat within the liver. Fat isn't usually present in the liver, but when it is, that also sets up an inflammatory change which leads to scarring. Clearly, when individuals are discovered by their GPs to have inflamed liver blood tests, it's appropriate to confirm what the diagnosis is, because there are many different conditions and they often require very different treatments. In the early stages, most patients do not know they have a problem with their liver, and that's important because it gives them time, hopefully with education, to reflect and decide, certainly in relation to alcohol, are they drinking too much? With fatty liver disease, another common liver condition which can progress to cirrhosis, individuals do need to be reviewing their weight, their calorie intake, whether they have diabetes, how much exercise they take. At the later stages of liver disease, people may present with a wide variety of symptoms, but generally jaundice, fatigue, a swollen belly because of fluid within the abdomen called ascites. But it's important to remember that alcohol also has other effects on the body. There's a much increased risk of indigestion, pancreatitis, which can lead to diabetes, high blood pressure. It might also increase the risk of heart attacks and strokes. But more importantly still, although we realise that cirrhosis is associated with liver cancer, alcohol also increases the risk of oral, throat, esophagus, large bowel cancer, and of course liver and pancreas. So clearly this is a major public health problem, not just because of the effects of alcohol per se, but all those other risk factors that may develop as a result of excess alcohol consumption. One of the difficulties is that most people underestimate their alcohol intake, and most people are perhaps rather unaware of how little alcohol is required to actually damage the liver. It's not just those that are drinking heavily, those that may just be regular drinkers are still at significant risk. And just to quote an example for that, everyone thinks they know what a unit of alcohol represents. In actual fact, they don't. A unit of alcohol, let's take a glass of wine as an example, is one 125ml glass. If you go into a restaurant, the smallest volume you will get is 175 mils. Well, that's 2.1 units of alcohol. A large glass, 250 mils. That's 3 units of alcohol. And remember, for women, we're asking them to drink less than 21 units per week. So 7 glasses of wine in a week would be more than enough, again, depending on body height and weight. So taking a step back and actually realising that alcohol is actually dangerous to the liver in large quantities, but even social drinkers may underestimate the risks. Well, individuals need to review their lifestyle. They need to look at their alcohol intake, how much they're drinking per day, how much they're drinking per week. They need to know their body weight. They need to know how much exercise they're taking. And those clearly lifestyle factors are very important with respect to the liver. If they have concerns, it would be sensible to visit their GP. A simple series of blood tests and or an ultrasound scan usually gives some idea of the state of the liver. And of course, if there are any abnormalities, then the GP may wish to refer on to one of the hospital specialists for further advice and management. When those people have been identified, then clearly we can adopt a management plan to reduce their levels to safe drinking, or if there is evidence of quite significant liver inflammation, we would advise them to stop completely.